licensed primary care physicians. Tennessee is not one of those states, but in the states that I'm licensed in, I'm a primary care physician. And so we take pharmacology, so I can prescribe drugs, I can draw blood, all the stuff that you would normally expect from a primary care physician I can do, but not in this state. So in this state, all I can serve it as is a healthcare consultant, and so that's what I'm doing. But if you go back to my original slide here, see if I can get there, I also have my master's in public health. I'm a certified health education specialist, and so my passion is empowering people and educating people to stay healthy. So being a natural health consultant is actually perfect because it allows me to teach people what they can do at home that's inexpensive and easy to do at home to dramatically reduce your risk of all kinds of chronic degenerative diseases. So, so this is practice for me, but it's also, I'd love to get bigger audiences and bigger audiences, and I'm getting there. So these are things that are in my scope of practice within licensed states, not in the state. So I'm board certified in pharmacology and emergency medicine and all of these things. But we also do botanical medicine and counseling, so I'm going to keep going. Here's a map of where naturopathic doctors are licensed, just so that, hold on, let me go back one more. Oh, it looks like one slide's good. It's missing. All right, so if you look, Tennessee's right here, that's dark blue. Dark blue means advocacy initiatives ongoing, which means we're trying, but we haven't gotten very far yet with anything. We don't even have a bill pending yet. But North Carolina, these three states in North Carolina are green. That means they're about to turn this color blue, and that means they'll be licensed soon. So it's creeping over from the west to the east, but we're still in this little group of states, you know, down here that I'm not licensed in. Okay, so let's keep going. So today's lecture is going to be about the top 6 health concerns of seniors, so really people 65 years and older and 85 years and older, and you know, are what causes death, you know, the top 6 causes of death, and what we can do to significantly reduce our risk of succumbing to those ailments. Okay, so let's go on. All right, it looks like I repeated the slides. Okay, so here are the principles of naturopathic medicine. The big one I wanted to point out is we are big on prevention. So, and you're going to see our therapeutic order. This is going to explain a little bit how I approach medicine, because it's different than allopathic medicine. So allopathic medicine is MDs, medical doctors. NDs, naturopathic doctors, we have a different philosophy. And so this is our philosophy, this is how we approach medicine. We have our own licensing board and our own, so I had medical exams just exactly like regular medical doctors, but we also are tested in homeopathy and botanical medicine and counseling and other things. But we still are tested in all the sciences, so embryology, physiology, pharmacology, all the same stuff. So it actually, we have about 1 year more in our curriculum than a regular MD for a primary care physician, because we have so many other tools in our toolbox that we learn about. So if you look, this is our therapeutic order. This is how we approach medicine, NDs. We start at the bottom and then we work our way up. So suppressed pathology would be drugs and surgery. And that's basically all allopathic medicine has to offer you is drugs and surgery. But we use that last. We start at the bottom. We try to figure out why people your body isn't naturally, you know, moving back towards balance. Because usually there's an obstacle in the way. So we like to remove the obstacles to cure. Because you can give all the nutrients in the world, you know, and supplements, and it's not going to work if you have mercury poisoning. You got to get rid of the mercury poisoning first. That's an obstacle to cure. So we look for the obstacles to cure and then we start to build up the foundation. So you might not have the cofactors you need to make stomach acid, and that's why your stomach acid's low or something like that. And so then we make sure you have the right nutrients and we build up your foundation, and then we reestablish your balance. So that's where we start. So that's my philosophy. So now back to aging and how we can age gracefully. This is looks like it's going to be glitchy. Sorry about that. Well, I'm glad I took screen captures. This shows the demographic distribution of our population. And what you're seeing here is in 1950, there's a lot of young people, okay? And then there's not that many old people. This is like 85 years old, and this is like under 2, right? So a lot of young people, and then as you get, there's less older people in our population. Then 25 years later, it starts changing. Basically, you're seeing this hump as the baby boomers moving over. That's what they're doing, okay? And so now, when you get all the way into the future, 2050, you started out over here with hardly, like, very little 85 years old and older, and now, in 2050, we're going to have more of them than anyone in the population, you know, as a whole. So the distribution's changing. This is good for all of us who are, getting older, because it means we're living longer, but, we really need to make sure we're staying healthy longer, right? It's like our quality of life is higher. Okay, so let me go on. So these are the top 10 leading causes of death in 65 years, and it always does this. It looks great on my screen, but it looks like overlapped here, so I'm gonna have to fix that. I apologize for that. But basically, this is 65 years and over, and that's 85 years and older, the top 10 causes of death. So what I'm trying to show here is the number one cause of death is heart disease. The second one is cancer, and that's for both 65 and 85 and older. And then number 3 that's CLRD, which is lung issues, okay, so respiratory type issues. And then down here we have Alzheimer's, stroke. So stroke, I combine that with heart disease. It's like vascular issues. And then we also have influenza pneumonia, which is related to lung issues. And then we have diabetes and Alzheimer's. So they're really close to the same, but not exactly the same. So diabetes, if it's going to get you, it's going to get you at 65 years old. But if you make it past 65 to 85, diabetes isn't going to get you. At least it's not one of the top 10, right? So, but they're very similar. So today we're going to look at the top 6 and what we can do at home to reduce our risk. Okay, so heart disease is the number one. We're going to start with heart disease. Heart disease is a all-encompassing term. So it includes all of these things right here. And so that's pretty big. And I would even include in there, strokes and those kinds of things, which is also in there, TIAs, because it has to do with vasculature health, so the health of your arteries and veins. All right, so we're going to talk about what we can do about it. So this gentleman that you see here is Dr. Blanchett, and he's one of my mentors, and I really love his philosophy for heart disease. He has a practice in Colorado, and he has treated thousands of patients with heart disease. Usually their coronary artery calcium score has to be over 2,000 before he'll even see them as a patient. And if you know anything about coronary artery calcium, a coronary artery calcium score of 1 is bad. So if you have 2,000, you're like right on the edge of having something bad happen, right? A coronary event. So he won't even see you as a patient unless you're 2,000 or above. And he has had 90% of his patients will reduce their coronary artery calcium score to a no-risk zone, and they don't die of a coronary event, 90% only by addressing these 2 issues right here. And that's amazing. So he says that only about 10% of his patients does he spend 90% of his time on, because they're the ones that they address those 2 issues, and yet their coronary artery calcium is still going up. But 90% of his patients, if they just address those 2 things, they're fine. He says they'll die, but they're not going to die of a coronary event, right? So, and he hasn't had 1 patient die of a coronary event. That's insane, out of the thousands of patients he's... Now, it's been about 2 years since I've gotten that statistic, so maybe he's had 1 die since then, but when I had been mentored by him, he had not yet had 1 person. He said they've died of other things, but not a coronary event, because he knows how to stabilize your plaque so you won't have a rupture, and that causes a stroke or a heart attack. Now, so hidden dental abscesses is the key, and sleep apnea. And so we're going to talk about these in a little bit more depth and why this is the case. So let me go on up. I thought I removed that slide. All right, so heart disease. So this is a great slide. It talks about how oral hygiene, not just dental abscesses, but oral hygiene is the cause of why it's one of the main things that leads to heart attacks and coronary events. The bacteria in your mouth has a very short path to your carotid artery and then to your heart, okay? So if you have periodontal disease, that means you have bleeding of the gums, your gums bleed when you brush your teeth. That's an open wound, and the bacteria from your mouth travel through that open wound straight to your carotid artery, straight into your heart, and it causes that bacteria causes an inflammation of your arteries, which makes your arteries sticky, like Velcro. So that means if you have, lipids and calcium in your blood, they're just going to stick like Velcro to the walls and cause buildup of plaque in your arteries, which could lead to a coronary event. So that's what this is talking about. It also leads to stroke. So they're talking about your risk of heart disease, it doubles, and your risk of a stroke is significantly increased, all because of just bleeding gums, the gum health, right? So we haven't even touched on dental abscesses yet, or root canals, which we're going to get to. So the main point I'm making is the bacteria in your mouth go through the arteries, that are open because they're damaged and also the pathogens from root canals and hidden dental abscesses drip like a slow drip of pathogens right into your arteries, and then it goes into your carotid artery, and then it goes into your heart. So that's what this is talking about. It triggers an inflammatory response, causing a blockage of the blood vessels, and that's exactly what happens. So, just to belabor the point, here is our inferior alveolar artery right here, which is the artery that's closest to the root of all the teeth on the bottom, the mandible, and that goes right into our internal carotid, and then it goes into our common carotid, right? So it's a very short path for all that bacteria, and they have actually sequenced the DNA of the plaque in your carotid artery, and the DNA has been sequenced to the exact bacteria that's from your mouth. So in other words, they've proven that the bacteria in your mouth is the same bacteria that blocks your carotid artery. So it's extremely important for heart health for you to keep your mouth healthy. Your mouth needs to be very healthy. And so on the previous slide, I had showed this book right here, The Hidden Epidemic right here. This is another mentor of mine, Dr. Thomas Levy. He's awesome. And this is an entire book showing how these hidden dental abscesses at the root of your teeth that sometimes are painless will slowly drip pathogens into those arteries in your mandible, and then it goes into your bloodstream. And so I highly recommend a 3D cone beam scan, and I talk about that. So what can you do to help your oral hygiene? I'm going to start with number 4 here, but you can remove all dead teeth. That means root canals. So yes, I recommend no one has a root canal in their mouth. It's like having a dead finger on your hand and trying to save the dead finger. It is extremely dangerous for your heart health. You need to remove all root canals and have implants done, because you're basically poisoning yourself. You don't realize it. And I don't care how pretty your mouth is or how healthy your teeth. I'm not interested in that. What I'm interested in is the #1 killer, which is heart disease, and that's the way you can prevent your risk of heart disease. So I'll pass this around. You guys can look at it. It's a great book, and it's a little bit frightening, but it's great. So a 3D cone beam scan can find those hidden dental abscesses, because you don't have to have a dead tooth to have an abscess. You can have a live tooth that has an abscess and you don't even know about it. One of the best ways to find out or to figure out if you potentially have a hidden dental abscess is if you have chronic sinus infections, because on the maxilla, on the top jaw, if you have a chronic sinus infection that you cannot get rid of, and it's always on your right side, it's always on your left side, it's like this part, it's like always congested no matter what you do, you might have a hidden dental abscess that's infecting that top, those roots of those teeth, they go right up to the edge of the sinus, the maxillary sinus cavity, and so it can cause a chronic infection. And so if you have chronic sinus infections, I highly recommend you go see your dentist and have a 3D cone beam scan just to rule out that you don't have any abscesses. Other things you can do, the #1 thing you can do for your oral hygiene is to change what you eat. That's the #1 thing. But a lot of us aren't going to do that, so these other things are great other options. Definitely brush your teeth. That's fantastic. Do that. And all of this, you guys, if you signed the paper, you can read through these. How many of you have heard of a tongue scraper? Okay, great. So I have a copper one right here. I recommend copper, but all of them will work, but copper will actually give an added benefit. And you just scrape your tongue. A lot of the bacteria in our mouth just hangs out and takes up residence in all the cracks and crevices in our tongue. So after you brush your teeth, you just scrape your tongue and you'll get a lot of extra bacteria out. It'll help your mouth health a lot. Some other things are that I talk about here is xylitol. So even when I travel, I take a little container of xylitol with me. And if you look up here, and I'm going to be showing some things, xylitol, 1 teaspoon of xylitol, you swish it, let your saliva dissolve it, and you swish it around in your mouth, and then you spit it out. Xylitol is an anti-adherent, which means the bad bacteria in your mouth hate xylitol. And so what happens is this will kill that bad bacteria and then allow it to release out of your tongue and not make a biofilm over your teeth. Because when we sleep, we get these biofilms, and some of the bacteria doesn't want to release. It doesn't want to let go, right? Well, this will help it let go. So I highly recommend xylitol. Do not ingest it. I don't recommend ingesting it because it's a sugar alcohol, and sugar alcohols over time cause digestive distress. So just swish it around in your mouth. It's sweet, it tastes delicious, and then just spit it out. So xylitol is great. You can buy it in huge bags for nothing, and then it'll last you forever because you don't even need that much. And then how many of you heard of oil swishing? Okay, it's a Ayurvedic or Indian tradition where you take, and I'll show you right here. I have two of them. This is the one that I have in my bathroom at home, and this is the one I take with me traveling, right? And basically you take a teaspoon of coconut oil, and then I dip it in xylitol just for added benefit, and I put it in my mouth. You let the coconut oil dissolve, and you just swish it around your teeth. This is after you brush your teeth. I do it a lot of times while I'm in the shower, just because you're in the shower anyway doing nothing, you might as well swish it around. And you need to do it for at least 5 to 10 minutes. Some people say more, but I think 5 to 10 minutes works great. It will regenerate your gums. So if your gums, you have periodontal issues. My sister had to have antibiotic shots in her gums. She was able to follow this protocol and regenerate her gums. Her dentist couldn't believe her gums were regenerating. They were regrowing. And it's because she started oil swishing and using xylitol, and her gums are fine now. So highly recommend it. And then don't spit it in the shower drain. You have to spit it in the trash can because it's coconut oil. It will solidify and clog up your drains over time. So please spit it in the trash can. So those are some of my big recommendations. But we need to go on because we have a lot. We have a lot to cover here. Okay, so remember there were 2 things you can do to increase your heart health, right? And it was oral hygiene, keep your mouth really, really healthy, and sleep. Those were the 2 things, sleep apnea, right? And it's because both of these cause inflammation, systemic inflammation in your body, and systemic inflammation makes your arteries sticky, okay? And when your arteries are sticky, that's when the lipids and the calcium stick to it to make plaque. So we want to do everything we can to reduce systemic inflammation, and sleep is a big one. So if you snore, you're probably giving yourself, it's sort of like a slow drip of pathogens. You're not getting the oxygen you need when you sleep. You need to work on opening your airway at night. It's super important. Some people say they just can't stand using a CPAP, but these mouth guards work great, and you can adjust the top and bottom jaw, and if you look right here on that picture over there, this airway opens. Your airway will open because this mouth guard will just adjust your jaw position slightly, and then that will allow you to sleep. Sometimes people don't need a CPAP. They can sleep much better with just this mouth guard. And they call it a oral appliance to distinguish it from like the teeth grinding mouth guards. It's not for grinding your teeth, it's just to open your airway. And you can talk to your dentist about them, they work great. And then here's some other ones that I have listed. Glycine is a big one. We're gonna hit on this one several times, but glycine, I think I have it right here. You can buy it in a big container like this. It's not super expensive. It tastes like sugar. It's a little bit sweet, and I highly recommend anyone 65 years and older, and I mean, I take it myself, and I'm going to be turning 50 this year, but it helps you sleep, it helps you build lean muscle mass, it helps cognitive health, it helps men with urinary frequency at night, reducing urinary frequency, so it's just an awesome nutrient. It's basically an amino acid, and people are saying, well, what does that mean? What is it? And so I'm going to just simplify it. It's steak. It's just one of the proteins in steak. Right? It's just, so it's food. It's just a derivative of food. So it's not a drug or anything like that. It's just great stuff. Okay, so here is just a pretty picture that shows the impact of glycine on sleep. And what you're seeing here, and I have a whole lecture for an hour and a half on nothing but sleep, and we're not going to go there today, but what you're seeing here is that when you first go to sleep at night, this is the beginning of your sleep cycle, the glycine will help you get delta wave sleep. And that's what you want. That's what we're all looking for. That's like a pressure washer for your brain. It removes the amyloid plaques and prevents cognitive decline. But basically, it helps you sleep. And that's what we want. So glycine's great. It also helps you build muscle mass, which is awesome. It also helps, this is the glycine group right here. It helps you be less drowsy during the day. So that's fantastic too, so you have more energy. And I could show you 1,000 more slides. And then these are generic ones you've probably all heard of how to get better sleep. So you can reference these later when I send you the PowerPoint presentation, but they're more of the common ones that you've probably heard of. Okay. Oh, this is one I wanted to reinforce because some people don't really understand how caffeine affects them. But let's say you had a cup of coffee at 8 a.m., then that's this one. Let's say you had another one at 10 a.m., you had another one right around noon, right? The half-life is 5 hours, which means you're not going to get sleepy. It's not going to be out of your system till 3 a.m., right? So that's something to realize. 50% of the caffeine will be out of your bloodstream in 5 hours, and then another 50% in another 5 hours. So if you keep drinking it, that's what it looks like. So caffeine might be affecting your sleep more than you realize, right? So it's just be mindful of caffeine. Okay, so now we're on cancer, and I'm gonna, let's see here. Oh, I'm doing great. I'm trying not to talk too fast, but I have a tendency to talk fast, so maybe I can slow my speed down a little. All right, so these are things that we've all heard, right? Reduce inflammation for cancer, good oral hygiene, but I'm going to come at this from a different perspective of cancer, so let's keep going. All right, what is the highest yield thing? Because remember, going back to heart disease, the highest yield thing you can do to reduce your risk of heart disease was sleep apnea and oral hygiene. So now we're on cancer, the second killer. What is the highest yield thing you can do to reduce your risk of cancer, of getting cancer? And the answer is change your body terrain, and I'm going to explain what that means. I had some fun stuff to show you too, and since I'm ahead, I might actually show it to you. All right, how many of you guys have heard of terroir with regards to like wine and different kinds of wine? Have you ever heard of terroir? All right, it's a French word that means that the soil and the environment and the climate and everything contributes to what makes that wine good, which is why, like the Champagne region, we call it champagne, because that's a type of wine that's all about the region, right? And so they invented this term. Like wine is not just about the variety of the grape, it's everything, this je ne sais quoi, this I don't know what, it's all of it combined. Well, it turns out our body has a terroir. So this is the terroir for like wine, right? And what contributes to the terroir is the type of grape, the flora and the fauna, that's like what kind of bugs and birds are in the area, the soil, the topography, the climate. Like, I love Alexander Valley wines, and that's a type of California, that would be the terroir. Alexander Valley has a terroir. Well, our body, so now let's look at this half. This is the terroir of our body, and so we call that our terrain. Okay, it's the terrain theory of disease versus the germ theory of disease. And as a naturopath, I definitely believe in the terrain. Our body just isn't these isolated things, it's everything combined. So all of these things contribute to our internal terrain, and we're going to keep going here. So this woman's fantastic. I don't know if you guys, how many of you have heard of TED Talks? Have you guys heard TED Talks? Highly recommend them. They're fantastic. They're usually about 10 to 15 or 20 minutes long, and they're experts that give a little lecture, and they're free on YouTube and anywhere, and you just Google them. But here's a link, so if I email you the presentation, you can click on the link, and this woman's talking about how the terrain of our body contributes to cancer. She's a cancer expert, so definitely check it out if you want. Okay, so how do we change our terrain? Well, this is it. These are the things, and I'm going to go through them right now. So that's just like a summary slide, and now we're going to go through them. Okay, this guy is amazing. He's named Dr. Lee, William Lee. And this is a fantastic TED Talk. If we have time, I'm going to show you a little clip of it. At the end, I'll go back and show you a clip because it's just spectacular. But basically, he's a cancer researcher, and he has proven through all kinds of studies that he's done that basically tumors cannot metastasize without angiogenesis, which is building of new blood vessels. So if we could somehow stop the little blood vessels that supply the tumor with blood, if we could stop that from happening, so anti-angiogenesis, then the tumor, we would never metastasize and cancer wouldn't be a problem, okay? Well, it turns out there are certain foods that are anti-angiogenic. They're awesome foods that prevent specifically abnormal angiogenesis, because there are areas in our body where we want angiogenesis, but not in tumors, okay? So this talk, he's really an engaging speaker. I highly recommend you watch it, but I might force you to at the end. This right here is a fascinating graph that I'm going to explain to you. Basically, this is bad. So this means the tumors are getting angiogenesis. They are building their new blood vessels. And these, the blue right here, these are anti-cancer drugs. So in other words, this drug would be great. That drug prevents angiogenesis of the tumors, okay? And then these are other drugs that prevent angiogenesis. But look, soy extracts right there. That prevents angiogenesis too. And then if you look up here, artichoke, parsley, berries, garlic, red grapes, brassicas, right? All of these work better than some of the anti-cancer drugs that we've got, right? So, food holds its own. Food will definitely holds its own compared to anti-cancer drugs. And they even make the drugs work better. So this is the drugs with the food, right? Look how much better they work, So we definitely need to be aware of what foods help prevent this angiogenesis. All right, so that's why all this are screen captures I stole from his TED Talk. So please watch his TED Talk. He's an amazing guy, and he's even written a book now, Eat to Beat Disease, and so I recommend that as well. Okay, so let's keep going. So what are some of these foods? So what do you look right here? So one of my personal favorites is called marzipan. How many of you heard of marzipan? It's like a candy. Oh my God, so good. Well, traditional marzipan is made with almond flour and apricot kernel flour combined. That's the traditional. Nowadays, if you buy it, it's probably all almond flour, right? But I make traditional marzipan at home, so that way I can put the apricot kernels in there. And lima beans also have the same component, which is called B17. There's all kinds of names for it. Laetrile, amygdalin, those are all synonymous with B17, which is the anti-cancer fighting compound. Now, it's extremely controversial if you look it up, but I've done a ton of homework on it, and I totally believe it. So this is a picture of my home, and we've got almonds, right? And then we've got apricot kernels. And basically, here's apricot kernels, that's almonds. I buy them, I soak them for 24 hours and rinse them, and then I pull the skins off, and then I dehydrate them, and then I grind them all up and make my own marzipan. And it's delicious, and we eat 1 to 2 of these marzipans a day in my household, just as that anti-cancer fighting, food. And it's delicious. It's hard to only eat 2 of them, but apricot kernels, you really don't want to eat too many of them, so 2 is probably good enough. But these are a whole bunch of books that talk about apricot kernels and how good they are for you. So that's just one option you can consider. Another one is modified citrus pectin. This is especially helpful for prostate cancer and for breast cancer. And I have it right here, so you guys can take a look at it if you want. So this is the reason I brought this particular supplement is because the studies that have been done on cancer with modified citrus pectin have all been using this particular brand, okay? That doesn't mean it's the only one that works, it's just the only one that they've done a lot of, studies on. But it comes from food. It's just citrus pectin. It's just the white part of the citrus, right? Which means we can eat that. When we peel a grapefruit and you try to get every bit of that white off, well, just don't. Right? Leave a little bit of the white on, right? But this right here is, these are chewable. They're like little chewable things, and they're actually delicious. And so, if you want to add a prostate or breast cancer runs in your family, you could chew one of those a night, each night, and it would be great. Okay, parsley is another big anti-cancer fighting compound, and I meant to bring what I have, but I didn't bring it. But basically, it has a chemical constituent called apigenin. And apigenin is extremely cancer-fighting, and lots of studies have been done on it. But it turns out dried parsley has a lot more potency because it's concentrated than even fresh parsley. So I'm not saying don't eat fresh parsley, you just have to eat a lot more of it, and it's hard to do it as a daily lifestyle thing. So in my household, we call Deb's parsley sprinkles, and then my mom has modified it, so now it's Terry's parsley sprinkles. But we have dehydrated and freeze-dried parsley, and then we blend it with all kinds of other stuff, like some cancer-fighting mushrooms and some nutritional yeast powder, and it tastes delicious. We put it on everything. We put it on just everything. We'll put it on vegetables, we'll put it on our salads, we'll put it on everything to try to get our 1 to 2 teaspoons a day. You don't need a lot to get a therapeutic effect. So we just try to incorporate these foods into our lifestyle. Food is medicine. So here's a study talking about apigenins and how it's the mechanisms of action, of how it actually fights cancer, but I'll let you read that on your own. All right, another thing is fasting, right? So I don't know how many of you have heard of intermittent fasting, but there's all different kinds of fasting. But basically, you want to stimulate your body to start doing a detox cycle, and most of us don't stop eating long enough for the detoxification cycle to begin. So you have to stop eating long enough for that to happen. And some people do intermittent fasting for cognitive health reasons, and I could do a whole lecture on nothing but fasting, but it's worth looking into. Even if you can just do a 2 or 3 day fast once a year, you're going to really decrease your risk of cancer. It causes all kinds of physiological changes that are worth it, and that's cheap. It costs nothing to fast. Just drink water, right? Okay, so another thing, cancer hates high oxygen environments, and it also hates basic environments. So in other words, an acidic body, a body that's acidic and a body that is low oxygenated is really good for cancer, right? So we need to change our terrain, and our terrain means we need to have a lot of oxygen, tissue oxygenation. We need to have not an acidic environment, but a basic environment. So the best way to get your tissues oxygenated is to exercise. You gotta exercise because that makes you breathe hard, right? So regular exercise that makes you breathe hard works really great. But there's also a lot of other interesting things that I can go into a lot of depth on, but I can't in this lecture because we're doing high level, is, if you think about it, you know, if you have, let's say you put a blood oximeter on your finger and you say, oh, I have 98, 99, you know, blood oxygen saturation, so I'm great, right? Well, not necessarily. The way I think about it is the blood in your veins has oxygen, and it's like cars on a highway, right? So let's say each car has four people in it. You got the driver, passenger, and the back seat, right? So you got 4 people in each car. That's a hemoglobin molecule. Hemoglobin can hold 4 oxygens. Okay, so now you got all these hemoglobins going down the highway, that's your artery. Well, what tells the hemoglobin to release the oxygen to the tissue? Like take the off ramp and say, okay, my thigh muscle needs the oxygen, or this cancerous area here needs oxygen, so you know I make it an inhospitable terrain for that cancer, right? What sends the oxygen where you want it? Well, the answer is carbon dioxide. So you can actually be your muscles or an area in your body can be oxygen deprived even if you have full oxygen saturation, right? Because if the hemoglobin won't let go of the oxygen, then it's not doing you any good, right? So we have to promote an environment that tells the oxygen to be released, and that's carbon dioxide. So how do we get carbon dioxide in our bodies? We do it by exercising, because when you exercise, you exhale carbon dioxide. So if I do a bunch of jumping jacks, I'm going to get carbon dioxide buildup in the muscles, and that's going to tell the bloodstream to release the hemoglobin, to release the oxygen there. So a very effective cancer adjunctive therapy that's used by a lot of naturopaths is EWAT. So if the person who has cancer can still move, like they're not bedridden, they can actually still move, what they do is they have you walk on a treadmill or use a recumbent bicycle or jump on a rebounder and then breathe concentrated oxygen. And then they have a lever that makes you go low oxygen, and that's like squeezing a sponge out. It fills your whole body with carbon dioxide because you're low oxygen. Then you turn the lever and you breathe concentrated oxygen. And that's like putting the sponge under the sink or in a bucket and filling it with fresh water, right? So you're squeezing out everything and then you're flooding it, and then you're squeezing it out and flooding it. And they've proven that EWAT, exercise with oxygen training, will increase the oxygen saturation of all your tissue like by 200-fold. So athletes use it a lot when they're training to try to get extra oxygen into the muscle. So there's a lot of different things you can do. I mean, even taking carbon dioxide baths, which how many of you have heard of those little fizzy bombs? You put the fizzy bomb in your bathtub and it fizzes, bath bombs. They call them bath bombs. That's carbon dioxide. So let's say you're prone to skin cancer in your family, right? So you get melanomas and stuff like that. Well, that means the whole epidermis and dermis, you need to somehow infuse your skin with extra oxygen. One way to do that is to take fizzy bath bomb baths, because the carbon dioxide bubbles will sit on your skin and it will pull the oxygen, the blood vessels that are closest to your skin will just start dumping oxygen onto your skin, just dumping it, because the carbon dioxide bubbles are telling the blood vessels closest to the skin to release oxygen. Does that make sense? Mm-hmm. So understanding that it's carbon dioxide that tells where the oxygen is to be released will help you get oxygen to those areas. Okay, and that's the Bohr effect. That's what we're talking about here. All right, let's keep going. Tissue oxygenation. One thing is make sure you're getting enough at night. That's big. We sleep a ton of our life, or we're in bed. So if you're snoring, you're not getting enough oxygen. We need to keep our airway open, and that's for cognitive health. It's for heart disease. It's so many things. It's one of the most important things you can do. This is an interesting thing that I don't think people realize. And let me see here. What does this say right here? I'm going to look real quick. All right, so 402, that's how much carbon dioxide is the concentration of carbon dioxide in here, which means we have great ventilation in here, because 400 is like outside. A lot of times when I do my lectures, I will put this sensor in here and I'll tell everyone, okay, it's 400, and then after the end of my lecture, with everyone in a room that doesn't have good ventilation, it'll be up over 1,000 just from my 1-hour lecture. So it's interesting. And so what this is showing, if you don't have good ventilation in your bedroom, this person measured it in their son's bedroom and it went up to almost 2,000. Well, 2,000, we're at bad for health, and it actually has been proven night after night. If your carbon dioxide level in your room goes up that high, it causes some cognitive decline because of stress, because you're not getting the oxygen you need in your brain. So it's something to think about and to be, I keep one in my bedroom to make sure that I'm getting good oxygen. But all you need to do is open a window and crack it and you'll get plenty of oxygen. But if you close everything up in the wintertime and don't have the ventilation on, it's something to be aware of. Okay, so now we're on acid. Remember I said cancer likes an acid environment? So if we can lower the acid and make it more basic, that's changing our terrain. We're changing our terrain. So there's a lot of stuff we can do to change the acid in our bodies. One thing is eating, but so I always like to go to the basics first. Let's just change what we eat. But baking soda is a big one. It's worth looking into. Even just taking a little bit of it orally can change your body's acid-base balance. Another way, the way I like to do it, is I just make green juice. So drink green juice will change the acidity in your body and make it more basic and alkaline. So that's a big choice if you like doing stuff like that. Okay, now we're on detoxification. So remember at the very beginning I was showing you all the things that contribute to our body's terroir, our body's terrain. And one of them is a buildup of toxins. That contributes to our risk for cancer as toxins. Our mercury amalgams, our fillings, they slowly release, every time we chew, they release mercury. And that's been shown on an awesome video that's on YouTube. Just type in smoking tooth. That's it, just type in smoking tooth and you will get a video where they put a screen in front of a tooth that they've extracted from someone's mouth, and then they dip the toothbrush in water behind the screen, and then they start brushing it like you would brush your teeth, and you see smoke coming up off the tooth. And that's mercury vapor. That happens every single time you eat and brush your teeth. If you have exposed mercury amalgams, you're poisoning yourself. You've got to get the mercury amalgams out of your mouth. But we all are exposed to toxins every single day, no matter what. So we can't stay away from every toxin. We can't live in a bubble somewhere. So I recommend just doing a normal weekly and daily detoxification routine. Saunas are a big one. I love it. Some people hate saunas. They can't get that hot. But there's tons of other things you can do to create a detoxification normal lifestyle program. Chlorella, spirulina are great. They're just little tablets you can take. They're green, so that'll also change your body's alkalinity. It'll make you more alkaline. So that's a double whammy there. So those are two great supplements you can take to slowly chelate and bind to toxins in your system. So this is talking about heavy metal again and how to get it out. Okay, and so this is another one. So modified citrus pectin. We talked about this for cancer, but it also is really sticky. It chelates lipids that are stuck to your blood vessels, so it'll lower your bad cholesterol, right? And it'll clean your blood vessels out, and it binds to heavy metals and helps get heavy metals out of your system. So I mean, this is, something that's really effective for multiple things, and it's basically a food. It's just the citrus pectin. It's just the white rind, right? So keep that in mind. I try to bring up only in this talk the really high yield things, because there's so many things. These are all the books and more. I have more than that, actually. These are just my electronic Kindle books that are on cancer. They're great. Some of them are better than others, but I highly recommend you looking into some of them, and that's where I get a lot of my sources for this information. And I've met a lot of these authors too, which is awesome. Okay, so now we're going to talk about cognitive decline. Okay, so once again, this looks like almost the same ones I had put up here for cancer. It's the same one. Reduce inflammation, have good oral hygiene, all these things. So we're going to go through them. Okay, so we already talked about oral hygiene for our heart health, right? Well, it turns out the bacteria in our mouth, just like it can go into your mandible and then go into your carotid and then go to your heart and cause inflammation leading to a coronary event, it can also go up to your brain and cause strokes and cognitive decline. So once again, I'm just going to belabor the point. Oral hygiene is very, very important. Okay, so sleep. This should sound repetitive, right? These are the same things as it was for heart disease, right? Sleep is extremely important. Losing just one night of sleep can cause an increase in the beta amyloid protein, the plaques that build up in your brain. And so if you remember that slide I had on glycine, and I showed you that you could go really deep into that delta wave sleep, right? That delta wave sleep is like a pressure washer for your brain, and it removes the amyloid plaques that are in your brain. So if you don't get delta wave sleep, you're not cleaning out the amyloid plaques. That's why it's so important sleep is for cognitive health. And if you want to hear me, I have a whole nother talk on sleep where all I do is talk about sleep for an hour and a half. Because it's so important. So there's a lot to it. I have all of my talks, by the way, including this one, I put on my YouTube channel. So I do have my sleep lecture on my YouTube channel, and you can watch it if you're interested. Okay, so let's keep going. Inflammation, once again. So this is one of my favorite things as a naturopath for how to promote your cognitive health. Okay, and it's something I follow, and both my parents follow it. It's called the MIND diet, and the MIND stands for Mediterranean Dash Intervention for Neurodegenerative Delay. but it's conveniently mind, M-I-N-D, and it's for your mind, right? So they have proven using this, and this is a summary of what this diet is, and I don't like the word diet, I like it more like this is just how you eat, and be mindful to try to eat in this way. But this is the big one right here. You have to have at least one dark green salad and another vegetable each day. That was hard for me to incorporate into my life because I don't like salads. But guess what? I eat a dark leafy green salad for lunch every single day. And I don't like it, and I do it anyway. And I do it because I want my brain to work. And it turns out, cognitive issues like dementia genetically run in my genes. And I know this because I just got certified in nutrigenomic analysis this last week. And so I looked at my whole genome, and yeah, Alzheimer's and other forms of dementia run in my family. So, I started this mind diet in my 40s, and I'm very grateful I did because it's been proven this makes a big difference. Berries are another thing I incorporate in my life every day. There's no way I can eat enough berries, I just can't do it. So I buy Bill Mitchell's berry concentrate, which is a special formulation of 9 different berries that have been proven that have the right anthocyanin content, and it's delicious. And if anybody wants to know about it, come talk to me. And I put 1 tablespoon in a cup, and then I put like sparkling water in it, and I drink my berry cocktail every night. That's what I drink. So it's one of my things I drink, and that's how I get my berries, right? I get my berries by drinking a berry cocktail. But I highly recommend you do these. This is really super important. Okay, and you can buy books on this. It's and this is another guy, Dale Bresden. He's amazing. This is a fantastic book. He's a regular allopathic doctor, an MD, but he did a very naturopathic study that made him famous, where he used a combination of 9 different interventions that are naturopathic interventions, many of which we just talked about, to significantly reduce and even reverse Alzheimer's in all of his patients, which made him famous. This book outlines his protocol. It's very easy to do. I highly recommend it. Okay, so then there's tons of studies, saying that optimizing your weight also contributes to your cognitive health. So that's super important. And then here's a summary, right? Regulate your blood sugar, keep your microbiome healthy. So a diverse microbiome contributes to your ability to sleep and to your cognitive health. So eat live fermented foods, live pickles, not just the ones that are in a jar on the unrefrigerated section. You need to go to the refrigerated section of the supermarket and get your sauerkraut and your kimchi, and your live foods there. You need live probiotics. Start eating those. Start tracking your sleep if you can, so that way you know if you're going into delta wave sleep. So I use this thing called an Aura Ring, and that's what this is. This is a screen capture from my phone, and it'll tell me how much delta wave sleep. So like this person, this was not me, 36 minutes. My goal for anyone 50 years old and older is 1 hour. You need at least 1 hour of deep sleep. And it'll tell you how much REM sleep you're getting, how much deep, and it'll tell you when. And like I said, watch my sleep lecture, you'll learn all about it. And so that's the Aura Ring right here. It's the best algorithm. I've tried about 5 different sleep tracking tools. It's definitely the best. And then remove pathogens, detoxify, and a lot of this is the same. Okay, so now we're going to talk about lung health. And I like this one a lot because it's become more important the last 3 years with things that have been happening. So believe it or not, people don't realize how, like I showed you at the beginning, what the top 10 killers were, or causes of death and there were 2 different lung conditions in those top 10 for both 65 and 85 years old. So that's a lot. So we need to be mindful of the health of our lungs, and we don't do that. And I am so adamant about lung health that one of my passions is indoor air quality, and I discuss in depth in some of my talks how to have good air, because it makes such a difference for your lung health. But these are statistics, and just to scare you. So these are all like a lot of statistics talking about what a big problem it is. Okay, so here are things that we can do to help with our lung health, and a lot of these are I think things that we've heard. Exercise regularly, that makes you breathe hard, great. This one I want to make a special point. Make sure your vitamin D status is good. That's going to help with your lung health a lot. But I have a caveat with vitamin D. A lot of people will say, oh, I got my blood work done, and the doctor says, I have low vitamin D, and he recommends I take 10,000 IUs of vitamin D a day, and so then you start doing that. I would be very mindful before you do that, only because allopathic doctors have no nutrition classes. They're lucky if they have a couple lectures on nutrition. And the reality is vitamin D3 should never be taken without vitamin K2 and vitamin A at the same time. Otherwise you can create a big problem. Because what happens is, if you take D3, it works really, really well, and it'll raise your serum calcium level tremendously. Okay, which is great for those of us who are menopause and we need the calcium for our bones. Great, serum calcium. But remember, just like oxygen on the hemoglobin, it doesn't do your muscles any good if it doesn't go to the right spot, right? Well, we need that serum calcium to go where we want it, right? Well, if it doesn't know where to go, then it causes problems. And if your blood vessels are sticky, because you're not getting enough sleep or you have a hidden dental abscess, all that calcium just sticks. It just sticks and causes plaque. And so you raise your risk of a coronary event tremendously when you take D3. Okay? So I'm afraid for people taking high dose vitamin D3 without taking K2, because K2 is like the chaperone, and it sees the calcium in your bloodstream and it grabs its hand and it will take it and escort it to where it needs to go, into your bones and elsewhere. K2 is so good at escorting calcium, it will even pull calcium that's stuck to your artery walls, it will chelate it out and take it out. If you have kidney stones, calcium oxalate stones, it will pull the calcium out of your kidney stones. Okay, so anywhere there's calcium that it shouldn't be, the K2 will move it to where it's supposed to be. So nowadays, supplement manufacturers are starting to get smarter, and they're making the vitamin K2 and the D3 combined. And I'm just going to up that one. You need A as well. It's like a three-way teeter-totter. If you increase one, you got to increase the other one and the other one. You got to have all three in balance. So there is a brand that I really like called Da Vinci, and they have a great ratio of, it's like one little pill, tiny little pill, and it has all three of them in the exact ratio that I recommend. But be mindful of that. If you want to hear more, write me an email. Okay, so how do you reduce your risk of respiratory diseases? Well, there's a ton of things to do. But nowadays, most of us have felt that we have acquired different kinds of lung issues over the last couple of years. And so my protocol is, first of all, especially with like COVID-19 and things like that, the bacteria likes to adhere to your sinus cavities, and it proliferates in your sinus, and then you inhale it into your lungs. Okay? So that's how, first you breathe it from wherever, you get it into your sinuses, it starts proliferating, that takes a few days, and then you inhale it in your lungs. So if you don't ever deal with it in your nasal cavity, you're going to just keep inhaling it into your lungs. You've got to get it out of your nose. So I always tell people you have to make your mouth, your throat, your nose, and your lungs, all four, an inhospitable environment for the pathogen. All four. You got to deal with all four of them. Now, if you're just trying to be preventative, my number one is your nose, because that's where it proliferates. So if you can get it to not adhere, right, to your nose, then you'll never inhale it into your lungs, and then you don't have to worry about your lungs, right? So I'll show you some of the things I use. So after today, after I'm here breathing the air with all of you, I usually go home and use this right here. Have any of you ever seen this right here? You can get this from Walmart for, I think it's, with the salt, it's like $10 or something. But it's just a squeeze bottle that's very squishy, and it has a tube that goes to the bottom and a hole on the top, and you fill it to the fill line. And then there's some salt I have here too. They have little salt packets, but I have some salt right here too. And you put one packet of salt in, you shake it up, and then you put it up against your nose, you go like this, and you just squeeze it. And I usually will squeeze half a bottle, and it'll come out my other side, and then I blow my nose, makes the best, right? And then I do the other side, like this, and then it goes the other half. And so it takes 30 seconds, like 30 seconds. And it's like brushing your teeth, and it will flush out anything that's in your nose. And so if you're around people,
Warm water.
right, warm water, and you will never forget the saline to put the salt in, except one time, because the first time you do it, it will hurt so bad you'll never forget again. Okay, there's the mucosa that's in your sinuses are very sensitive to saline balance, the osmotic type balance that's in there. So when you put it in and you don't have salt in there, it hurts. So when you buy this, it has these little pre-measured salt packets that are pure salt, and you just put one packet in, go like this, and then just push it through, right? And this is one of the best things you can do to prevent yourself from getting COVID-19, right here, okay? And So that's one thing I recommend. This is the old-fashioned style, which I like to use too. And sometimes you fill this with water and salt, and then you put it against your nose, and then you let gravity drain it out. This is the super quick. This one will take a few minutes because I have such small passages that I have to sit there forever while it drips out. This one I just shove it through, right? It's like force, right? So this is for quick, and this is also lighter weight and easier for me to take traveling. So I never go anywhere without this. I travel with this, right? So that's in my travel kit. So why am I talking about sinus health for lung health? It's because a lot of the pathogens that get into our lungs start out in our sinuses, right? So keep your sinuses clear. It takes 30 seconds. It does not take a long time. Okay, and it does a lot of other things too. I've healed so many people's problems with using this daily. You know, to me it's like brushing your teeth. You brush your teeth every day, rinse your sinuses once a day. Or at least after church, after you've been in an environment where you're breathing a lot of other people's air. So keep your sinuses clean. Okay, so there's also breathing exercises using this app that helps you control your breath, which is very healthy for your lungs. But another big one, if you feel like it's already in your lungs, or you really want to be preventative, to me, every single home medicine cabinet should have one of these. You can get them from Walmart. It's super simple. You fill the bottom with water right here. So you just put a little bit of water in here, and then you put the thing back on. And then they come with these little discs that they have essential oils on. You don't have to use that. That's not mandatory, you know, but you can if you want to put some essential oils like eucalyptus, I think, and lemon is on it. And then you put the top on it like this, and you can control with this dial how much steam. You plug it in, turn it on, steam comes out, and you just breathe it for 5 minutes. And then you breathe slowly. So most people are like a balloon. They only are using one little tiny part of the balloon, like in, out, and they're not doing a full exhale and a full inhale, so they're not getting the air all the way to the bottom of the vital capacity of your lungs. So the way you make sure your entire lungs are filled with the stuff is you have to exhale very slowly for like 6 counts. So you count, like literally count, okay? Then inhale slowly. Right? And it's the slow counting that will help you use the full vital capacity of your lungs. And so you do that, count slowly, breathe, and then you will get it'll loosen the mucus that's stuck, right? And you can put a little bit of saline in the water as well, and that salt will also help get rid of anything that's in your lungs. Thank you, Mom.
What is that device called?
I'm sorry, what?
What is that device called? What's it?
This device,
Yes.
Steam inhaler. Yeah, and they sell them at Walmart. They used to be really cheap, but then since COVID, they've gotten a little more expensive. I think they're like $35 now or something like that. Okay, and then another thing is a lot of people feel like it's really deep in their lungs and they're coughing and it just feels deep like bronchitis. Well, you know, if you have a friend or a spouse that's living in your house, you can do what's called tapotement, which is like that on your back, right? So you breathe the steam and then you do tapotement on their back, and it will loosen and dislodge the mucus that's stuck, and it'll allow them to cough it out. And that's really, really helpful for all kinds of COPD and other kinds of things. But if you don't have someone there or that's too hard to do, these are 2 devices that do something similar. They're called, one brand is AirPhysio, and they call it a, I can't remember the name of it, a vibrator. They have some very complicated name for what this is, but all it is it's very unique, and I love it as a mechanical engineer. In my last life I was a mechanical engineer, but there's a little ball, this heavy ball in here, and then you just take the cap off and you breathe, you exhale. It causes a back vibratory pressure to go into your lungs, which dislodges the mucus. Does that make sense? So you can do it at home, and you just exhale the right way, follow the instructions, and you'll feel this weird vibratory pressure going into your lungs that will help you dislodge it. So, you know, with COVID season, I love them. I have 2 myself just in case. I've never had to use them myself, but I've lent them out to people and sterilized them because they've needed them. But everyone should own one for their lungs. Okay, so now we're 5 minutes left, so I'm going to go really quick. That always happens. So now we're on accidental falls. This is the big deal. So, you know, people, when they break their hip, you know, because they fall, it's pretty short spiral out of control from there, and it really shortens your life a lot. So if we can prevent accidental falls and accidental injuries, you will increase your lifespan tremendously. So interestingly, the muscle mass mass on your legs, specifically on the thighs on your legs, right? The thighs, has been directly correlated and associated with longevity. And that's interesting, don't you think? Like, so we all of us, men and women, lose muscle mass, especially after 50 years old. And it's really hard to retain it and keep your muscle mass. And so my speculation of why the thigh muscles are associated and correlated with longevity is because, let's say I'm going to fall, you catch yourself with your thigh, right? So if you're not strong enough to catch yourself from your fall, you'll then fall onto the ground, break your hip, and then so that's I'm just guessing on that one, but that because it seems odd why with thigh muscles especially. But there's a test we do at the clinic for elderly people and anybody really to see, because it tests like 3 different things that are super important to prevent accidental falls, and it tests them simultaneously and very quickly. And let's see if I can do it. Basically, you sit down, right, and then you stand back up again, and it's hard to do with these heels on. But do you see that? I sat down, and it's easier when I don't have these rubber heels on, but I'll do it again, okay? You sit down, and then you stand back up again, like that, right? Okay.
What's he saying, Mary?
Now, let me tell you when you get something, a point marked off. You sit down, right? And then you go like this to get up. You see that? I went over to one side, and I used this hand, right, to help myself get up, right? That would be -1 or 2. And then another one is if you go like this, and then you put your hands on your knee and help yourself up like that. That's like a minus. So we watch. We don't tell people. We say, okay, get up, right? And then they either get -1 or 2 or 3, depending on how they get up, right? Because what happens is we're seeing your joint flexibility, right? Can you even sit down in Indian style? Like, are you flexible? Your knees flexible enough? Are your ankles and your knees strong enough to take the torque of lifting yourself up? Are you symmetrical? Because if you notice me, I'm not. One of my thighs is bigger than the other. You can see it. This one's bigger than that one, right? I can't activate that muscle. So I always preferentially use this leg, right? So, but you know, it takes leg strength to stand up, right? And it takes balance. Okay, so we're going to go through how to prevent accidental falls. So how do you prevent? Well, you optimize your proprioception. That's balance exercises, the ability to balance, okay? And there's many things you can do. You increase your lean muscle mass, and you increase your bone density. So if you can do those 3 things, you dramatically reduce your risk of having an accidental fall and an injury from an accidental fall. Because let's say you fall anyway, like there was something and you fell. If you have good bone density and good muscle mass, it's protective and you won't break your bone, right? You might get a sprain or something, but you're not going to break it. So those are the 3 big things. And there are simple things you can do that don't take that much time, you know, but you have to be consistent, that really help a lot. One of them, many of you in here are familiar with, like my mother and some others, is using a whole body vibration plate. How many of you have heard of a whole body vibration plate? Probably nobody. Okay, a couple people. So what happens is, it's a little plate you can buy, it's a little machine, vibrates, okay? You can control the frequency. 40 hertz is best actually for bone density, but you can get a whole chart on if you're trying to repair a knee joint or an ankle joint, and you stand on it for 10 minutes a day. That's it. And you do, I recommend for preventing accidental falls, just doing squats like this. Now I have a 7-pound ball or a 10-pound ball I like to hold, and I'll try to like hold the squat, you know, and then stand up. But what happens is, NASA discovered that the astronauts all got osteoporosis. And it's because our bones are a dynamic living tissue. They always remodel. Every second our bones are remodeling. And so if all of a sudden you have no load on your bones, they remodel to become like a bird, right? You know, all the porosities, we have osteoclasts and we have osteoblasts. That's the bone builders and bone chewers. And the bone chewers just start hollowing out all the bone, right? Because we don't need the bone if there's no gravity, and it happens right away. And they have permanent osteoporosis. So they had to figure out, how do we keep our astronauts' bone density? Well, they use a whole body vibration plate up in space. So they have this little vibratory plate, and they have to have a band that like holds them down, right, onto the plate, okay? And then they'll do squats and stuff. They'll wait and they'll do squats, and that keeps their bone density. Because what happens is, you know, what makes the osteoblasts, the builders, fill in the porosity, like build bone in your porosities? What is the signal? Just like carbon dioxide is a signal to release oxygen, what is the signal to build bone inside the porosities? Not abnormal bone growth, but normal bone growth, the kind of growth we want. The answer is acceleration. So what is an acceleration? It's this. I am now telling my bones to become denser. Jumping tells your bones to be denser. Well, some of us don't want to be jump roping. We're too old to jump rope or whatever, and we're not going to go jogging because our knees and our hips and everything else hurts, right? Our back, our spine, it all hurts, right? So we're not going to be jumping because jumping doesn't feel good. Well, so how else do we stimulate the osteoblasts to build? Well, whole body vibration on a microscopic level stimulates the osteoblasts to build, because the osteoblasts perceive on a microscopic level all that vibration as jumping. Okay, so basically, and in 10 minutes you can replicate hours worth of jumping in 10 minutes. And it's better if you do for your muscles and your ligaments and your joints if you put them under load. So if I have a 10-pound ball and I'm doing a squat like this, I'm putting pressure on these knees, but what my knees are feeling is that I'm jumping the 10-pound ball. So it will actually rebuild the strength of all my joints and ligaments. It promotes joint healing. It's really amazing. I highly recommend you look into it. We have one at our house. We're about ready to upgrade another one. It works really well for any pain. So even sciatica, I've had people with sciatica get on it and their pain will go away. So if you have spine pain, you know, any kind of joint pain, muscular pain, ligament pain, it will help. But it especially helps with bone density. Okay? All right.
Call that again.
Whole body vibration. I have it on right here. Use a WBV, a whole body vibration machine. And there's a couple that I recommend, especially because I have a whole nother lecture that's on nothing but bones and bone health and preventing falls, right? So this is my high-level lecture where I just introduce you, but I have a whole lecture on each of these topics. Like I go into depth. And okay, so now glycine. This is just to tell you. Remember, I told you glycine is good for sleep, but it helps you build lean muscle mass, especially when you sleep. So once again, 1 teaspoon in your chamomile tea before you go to bed is a great habit because it'll help with your cognitive health. It helps with urinary frequency at night for males. Also helps you build muscle mass, so it's really good. Okay, and then lastly, because we're over a couple minutes here, and so I'm just going to go through real quick, is our urinary tract changes as we age. I'm just going to